So, yeah, the blanching has begun. I want to make sure. Yep, you're good there. And I'm going to start on this end here. So, that's the sound that you'll hear. It's kind of like a nice humming. Scale of 1 to 10, 10 being the worst. How's that for you?
It's very, a 2. I mean, it's nothing.
Oh, great. And that's probably because I am using a light hand. Also, I am, let me yet again change my gloves. I'm yet again using a light touch with the microneedling, but that numbing gel is perfect for just a little bit of open skin. And that's really my secret for doing a quick procedure for my client, because they don't really want to be in the office as much as it takes to numb for 20 minutes, and then you hope for the best. But doing the dermafrac first will always will make sure that you get a good numbing agent. So when I turn here, so you guys can see, you could see that her whole upper lip is white in color, and that's because of the numbing gel. So I know that I'm able to proceed not so much with a heavy hand, but with a hand that will actually encourage blood flow, because once that blood flow gets to where we need to get, it takes toxins away, but it also helps with the cascading of wound healing. And that's the whole purpose of this. So let me see, I know on film up here, yes, we're able to see. So more importantly, I've got her in my film here, so I'll show that to you later. But I'm going to try to do this so you can see it a little easier, what I'm doing. You can see the blood flow. You can see it turning red here, and that's what we want. So I generally make 3 passes, but what I'm doing is getting the skin opened, going into the belly of each of these little lines. So the 0.5 dermafrac gets into the skin at 0.5. If you want to just get into the wrinkle at 0.5, you can, but you need to have it focused with a tiny tattoo needle. So there are ways to just microneedle, and yes, you'll always get a nice response with just plain old microneedling. But when you want focused attention on fine lines, deeper wrinkles, you will get it with MCA, Multi Trepannic Collagen Actuation. This is bringing all kinds of great fibroblasts up to the surface, and I'm lightly touching the skin. You can see the blanch, you can see the blood flow. So even though there was epinephrine in the tag gel, you're still able to get the blood up to the surface. And I've had some people say, well, then you're not really getting good microneedling if you have blood out of the area, because the epinephrine will push the blood out and make it less bloody. So you can still see there is a little bit of blood, but if there wasn't the tag gel, there probably would be more. And is that still pretty comfortable for you? Okay, good. And the reason Claudia is up for the challenge today, her good friend had this done and got really nice results with one treatment. But I want to get her rescheduled for a few. She had some dental work that kept her from getting some more treatments, but we're maybe going to get her on the train again here. So I can't read your comments or your questions, but I've had a lot of questions this week on who can do this procedure. So if you want to augment your microneedling procedure with more focused attention on the fine lines and wrinkles. Somebody that can do this would be a tattoo artist or a micropigmentation specialist, a cosmetic tattooist, somebody that does microneedling. If you can do microneedling, even at 0.5, when you can do this, and I'll show you later in a film how I put this all together, but if you do microneedling, just make sure that you can go 0.5 and beyond in your state so that you could do this. The cosmetic tattooists like myself have been taught this procedure since the late 90s and have done this many on occasion. So when I was training nurses to do permanent makeup, this was the very first procedure that we did when we sat down and worked on skin, because I felt it was really important for the nurses to feel the needle. Oh, that was a little touchy. The needle into the skin, how the machine feels. And this was our first procedure we did on skin with our tattoo needle. And this prepped them to be able to work around the eye, the eyebrow, the lips, and gave the client an extra added bonus of wrinkle reduction. So just like microneedling, you want to schedule these in a series, and a series would be every 6 weeks. I would microneedle people every 3 to 4 weeks, but this you want to definitely wait 6 weeks because you will have remolding of the the fibroblast, the elastin, the collagen, and it takes that long for that process to actually stop. So you might be doing too many procedures and not getting that much more benefit. So you want to wait at least 6 weeks. And the steps that I'm using right now, the pointillism, it's actually like a dot matrix that we go ahead and create a line so that we're actually getting our needles deep right into the belly of the wrinkle. We don't want to work on the sides of it, so I am stretching the skin so I can get the needle, and I'm using a tight needle, a type 3. You can use a single needle, but with a single needle, sometimes you can go too deep. I have my needles out about the width of a dime, which is 1.0, and this way I am getting deeper into the skin. And if you're just using a 0.5 and say you can only use 0.5 in your state, well, you'll adjust your needle to 0.5, and when you stretch the skin and you're actually depositing the needle into the belly of the wrinkle, then your 0.5 is enough to really create this type of effect as well. So don't be sad if you can only go to 0.5 in your state. You can dial this in half the size of a dime and still be able to get good blood flow like you're seeing. You still comfy?
Mm-hmm.
Okay, good. And I'm going to do these. I see one here, one there, and this little lower one. So I am going to put another swab of numbing gel on here and then go over it again. I'm going to and go do that right now. And this is the way it will look today too. So my client is well aware. Her friend had it done, so she knows that it does look a little crazy, but it only looks crazy for a day or so. And tomorrow she could wear some cover up if she needs to. It's easily covered, so it'll get a little crusty, and the crust will be there for about 3 days or so. And it can be camouflaged, but not today. We don't want that to occur today. And when you do this pointillism, you're pretty much at a pretty much a 90-degree angle, and we want that three-prong needle to go right into the skin. Now my first pass is always a little bit ginger on the skin. And you can do this pretty much on any part of the body. You know, there are procedures that for the upper lip as well. Probably one of the very best might be a CO2 laser. Some of you might do fibroblast out there. The difference is that some people don't want to undergo those types of procedures. Maybe the healing process for them is a bit much. So you can opt for something that will work well, maybe not as well as a CO2 laser, but they'll get a really nice result and not have to go through that. So that's always something that people want to know is, will it really be effective? And there are other, it's always nice to know that there are other ways to go about these wrinkles. Also, it can be done nearly every place of the body if you decide that you want to do this. Like stretch marks are also something that you can get into and do. But selecting the correct client is also important, because if we have a client that say they have some vertical lines on their face because they sleep on one side, or they're belly sleepers, they may not be the very best clients because you won't get a good outcome. They should adhere to your aftercare. Claudia here does use Definage, and she's able to use that today in her aftercare. So make sure that your clients have a good something in your office that you know is compatible with microneedling, being able to get into the channels. So now I'm going to go over the lines again, and I'll see how this feels for you, Claudia. I'm just trying to make sure that they can see that too. Is that okay for you? Okay. So you'll see that I'm a little bit more in tension. I can hear the motor of the machine changing. That means I'm getting deeper into the skin where my needle is to go. My first pass, I was a little ginger. I didn't really want to go for it because I wanted to get some more of the topical in there. So when you add this onto your microneedling, if your microneedling is deep enough, then swabbing on the tag gel is something that will get into the skin right away, and you won't have to sit and wait for numbing gel to work. You can hear the motor changing. And you can see that, I don't know if you can see, but my needle is out the width of a dime. I don't know if maybe you can see that, but you can see it here. And that's where I want it to get into the dermis. Claudia, you're doing so good. Thank you. So you can see it's a pretty easy procedure, but making sure that you can actually see the belly of this wrinkle is important. If you go off kilter, no harm, no foul, but you won't be getting that intentional needle into the belly there. After I do this, I'll be doing the rest of her microneedling as well. I stretch it a little bit just to make sure I can see that. The only reason I don't always like to use a single needle is because the three, I think, makes it go a little quicker. But sometimes the single needle is like a harpoon, so there's no resistance around it, and sometimes you could slip and go too deep if you don't have your tip to your tattoo gun, or like this Midas 1100 secured. If it slipped, you could actually go in a little deeper than you'd have to. Again, really no harm, no foul, but it's not what you intended. So she's doing pretty good here. You can hear the motor changing on the machine. You can do this. I have every tattoo device. You can use your Nouveau Contour, which I have. You can use your traditional coil machine, which I have. But I like this Midas 1100 for a few reasons. It's very economical to use. To set this up and use for this procedure, your consumable is approximately $6. Your Nouveau might be $20 with your needle cartridge, and your traditional coil is about $8 or so. So if you are someone that does permanent makeup, you certainly can do this procedure as part of your licensure. The American Academy of Micropigmentation see this as a strictly cosmetic procedure, not a medical procedure. Wrinkles, rhytides, whatever you like to call them, they are a sign, they are caused by aging and scars by past trauma. So we're just getting down into that 1.0, maybe just a tad lower, to help with these rhytides. And I know you guys have questions for me, so in the comment section you can certainly ask them, and I will get back to you later today with this video, and so that you can see it from overhead. I'm lightly stretching the skin so I can get right into that wrinkle there. Yep, there we go. Now, suitable lines and wrinkles around the mouth I've had very good success with. Lines of the around the labial fold there is something I haven't, and the reason is because there's usually cheek behind here. So the cheek is something that will push down as we get older, and you won't be able to really rid these lines. Now, if somebody has had filler, they're a good choice to do these as well. If the lines have been filled, but yet there's still a little bit of a line left, yes, they are good ones to do because they've been filled as much as they can be. You can help take that a little further. Just make sure you speak or let the injector know what you plan on doing. They may have a time frame for which you can and cannot do this. You won't be wanting to work right around the time that they're doing it, but check with your injector to see what their time frame would be. I'm going to give this one more pass. Now, forehead wrinkles are something, especially if they've had Botox, but they still have some residual wrinkle. That's a great place to work. Absolutely great. So this is how, let me just turn you this way. This is how it will look for the next 2 days or so, but it gets lighter every day. I'm going to make one more pass with this. So, because I like to make 3 passes in each of the lines myself. And let me just, yep. Just going to clean that off a bit more. There we go. And then, of course, we're going to use deep red LED too. But I'm going to microneedle the other side of her face before I do that. The numbing gel gets a little thick on the skin, maybe like a little Elmer's glue, but I can still see these nice lines that I've tracked. I can hear the motor change in my machine. It's humming along. So if your client is comfortable, this is really a breeze of a treatment, no matter where you work. But this would be probably one of the areas that would be the most tender. And you can see that she's doing extremely well comfort-wise. And there was no pre-numbing. All the numbing took place during microneedling and the MCA. So her aftercare will be just as if she was doing aftercare for microneedling. She's going to be using the Depanage 2 system and won't be using the scrub for at least 5 days. I like to do a gentle stretch. I don't need to stretch so hard, but I know that I'm getting my needles into the skin much deeper than my 0.5 was with my Dermafrac. So this way, when she comes back for her next treatment next month, there should be a nice difference in these and as well as overall skin with the Dermafrac microneedling procedure. So you can see how fast this goes when I'm not chatting so much, but and I'll answer some questions in just a second. I love to hear that motor change. So I know people have asked me this week, what about all the stretch marks? I'm not a huge stretch mark fan, even with this MCA, only because people that have the problem with stretch marks, there's a whole lot of them, and it won't make them look as great or as perfect as they would like. So I feel like there's a little unhappiness with those as opposed to like the facial ones that I love to do. I know which ones are going to work well. You'll see some video today as well, like around the eye. The crow's feet work well, so long as they're not super dynamic. If you're trying to say do someone's 11s, well, if they're very deep and the client continues the muscle action, you're not going to get the best result. But if you have someone that has gotten Botox and have that muscle super relaxed, but yet you still have a few lines, that's perfect to do. And you will get an excellent result. The client will be super happy. But if the muscle is in action so much, it won't. It'll just continue to be there. So that's an important aspect when you're selecting your client, even though anyone can pretty much have this done, so long as there's no dermatological disorder in the area. They're not on, say, they're not in active chemotherapy where their immune system would be down, but this is such a great procedure for overall skin health. And you might even see some people using these types of machines quite often, like over the skin, over the cheek. I just like to use this for pinpoint areas, just like this. So again, for all of you out there that do permanent makeup with a machine, this is perfect with a 3-round needle or a single needle. I don't use anything bigger than that. The 3 is generally what I am going for because I love to get 3 prongs in each time. Okay, that's pretty good there. I'm going to go ahead and just clean this up a bit.